Okay, so we're moving to the next stage of labor, which we'll be discussing this morning. And this is the third stage of labor. Third stage of labor. So we're just trying to look at what is the uniqueness of the third stage of labor. But if I were to give you guys an overview of the third stage of labor, I'll just simply say in the third stage of labor, you have delivered the baby, the baby, everything is fine. So you are just left with the placenta to deliver it. Okay, and the way I see my superiors in the hospital doing this is more of like trying to contract the uterus, either by palpating the abdomen, or you can give oxytocin to enhance the contraction. So third stage of labor is just after the baby has been born. So it ends with the delivery of placenta. So first stage, the baby is coming. After I deliver the baby, third stage is all about delivering the placenta. Okay, so you deliver the placenta and its membranes. So sometimes you deliver the placenta, but there are some retained stuff. So make sure that everything is out. Okay. So though it is often overlooked, the stage is very important for the mother, because the baby is already out. So to ensure the safety of the mother, you have to make sure that everything is brought out. Okay, so what happens during the third stage? There's uterine contractions, placenta gets separated from the uterus, expulsion, okay, so of the placenta, okay, then bleeding is followed by a lot of bleeding, okay, which is normal. All right, but just make sure that everything is like fast and controlled. So two types of management during this third stage of labor is expectant, so just physiological management, so no drugs or intervention. Placenta is delivered naturally, often within 30 to 60 minutes. But the active one, that's when they now give oxytocin to like help it. Then the Andrews method, where they kind of like controlled contraction, okay, as you are trying to like massage the abdomen, okay, that's over the uterus. You are just pulling out the cord small by small. All right, so uterine massage after the placenta has been delivered too. So duration is just 5 to 30 minutes. Longer duration may increase the risk of retained placenta or much more bleeding. Okay, so placenta is examined to ensure it is intact. That's after you remove out. So any retained fragment must be removed or prevent infection and bleeding. So in Africa, we usually ask the mother whether we should give her the placenta or we should go and throw it. Africans, we still have that traditional part of us. So that's it for the third stage of labor.